This video on coronavirus, COVID-19, is being made the first week of April 2020, and the world is in the hands of a pandemic caused by this virus. This video is going to be specific to the COVID-19 virus, but the basic principles that I'm going to present are pretty much universal against any germ or virus. What makes the COVID-19 so unique? Well, there's two attributes at minimum with viruses that are very important. One is how contagious they are, and the second one is how virulent or deadly they are. The COVID-19 virus is extremely contagious for two major reasons. One is COVID-19 can survive on surfaces. Now, it depends on the nature of the surface, but it can be for a few hours to 2 to 5 days. And if you touch that surface and contaminate your hand, you're still okay until you bring it up to your mouth and touch your eyes, nose, or mouth. Then there's a good chance that you will be infected by COVID-19. The second reason that it's so contagious is it appears that a person who shows no outward signs of the disease can be contagious for 5 to 14 days. This is key on why it's so contagious. Also, it is quite virulent. You will hear statistics ranging from 1 to 3% of those who get COVID-19 will pass away, will die. And currently, all these politicians, they're trying to be optimistic. I get that. They think they're the chief morale officer of their state or country. But I've been following one state's Department of Public Health statistics very closely. Besides being a retired registered nurse, I'm also a retired certified public accountant. So I'm always going to look at the numbers. And this particular state has over 6,000 positive cases. And interesting enough, the deaths are 3%. Now I realize there's a lag in reporting, there's a lag in people recovering. There's also a lag, unfortunately, that you're put on the vent, and there's not much hope you're going to recover in some cases. And so, but that vent's going to keep you going until they finally take it down and the person passes away. But 1 to 3% is a fairly conservative amount. And when you multiply that times a large number, you can have a lot of casualties, a lot of people dying from COVID-19. So it's very contagious and pretty virulent. It's pretty deadly. Now, one of the fortunate things is it's not smallpox. It's not Ebola, where the percentages are huge as far as death rates there. Now, what can you do to stay safe in this situation? Rule 1, stay at home. Just stay at home. End of discussion. So if no one has contracted COVID-19 in your home, it's probably a clean space. It's your safe place. So try to keep it that way. Now, we are in a period where there may be reasons you have to leave your home. One would be if you're on prescription drugs, whether they're for a heart condition, diabetes, respiratory problems, and you can still get your prescription drugs. It's worth going, in many cases, to the pharmacy and retrieve those prescription drugs that you need or someone in your family needs. A second item is there are families where they're still required to go to work. They're essential personnel. So I know of one family where there's 3 breadwinners, if you will, in the home. 2 of them are working from home for their company, and the third one has to go to their company to work. The third item I submit at this point that you would consider uh, leaving your home is to get high quality, nutritious groceries. Now, if you've watched my video series, you know I'm into preparedness. So yeah, I have plenty of iron rations, long-term storage food, bean, rice, oatmeal, and those are all very nutritious. But if you can still go to a grocery store and get food that is high in vitamin C, um, bread, milk, quality protein meats, if you can get soups, and even in some places it's difficult to get soups. A friend of mine was telling me when she went to the grocery store, they only allowed her to get 2 cans of soup. I assure you, my wife and my daughter can take any sort of piece of beef, meat, or a chicken, and they can make fabulous homemade soups. Far better, in my opinion, than you can get it at a supermarket. So periodically, it may be worth it to go to the grocery store every couple of weeks, every third week, and get some nutritious food. You want to make sure your immune system is powered up. So you may have to leave the home, but what I would submit there is you have one shopper. You don't go as a husband and wife. You certainly don't take the children. You have one shopper. Now, having said that, I recognize they're single parents and they may have small children, and it may not be feasible to leave them at home by themselves. So if that's the case, you've got to really double down on some of my recommendations. But rule one predominantly is stay home. Rule two is keep your home clean. Your home and your car should be your safe place. So if you have to go out upon returning, and this is what I'm doing, first of all, the shoes are left at the door. The next thing is, at the door, everything comes off. You know, I'm wearing not this particular protective vest or outer vest, but I take off the vest I'm wearing. Off comes the shirt, the pants, the belt, the socks, the underclothing, and they all go into a black garbage bag. At that point, I go into the house, I wash my hands. You wash your hands with soap and water for 20 seconds. Remember to interweave your fingers. I went to college to learn that. And then, as Dr. Grupa shows, you get your thumbs. So 20 seconds washing with soap and water. Now, if you don't have access to soap and water, a hand sanitizer is excellent to use. However, as a general rule, soap and water trumps a hand sanitizer. And there have been white papers, research papers done by college professors to prove that. So given the choice of soap and water or hand sanitizer, I'll take the soap and water every time. But you wash your hands, and then directly you go into the shower and take yourself a good soap and water shower. And then you carefully go out, keeping the garbage bag closed. You take it to your washer, turn your head as you empty it into there, put plenty of soap in there, set it on hot water, and run it through a hot water sequence through your washer. And then when it's completed, you put it in the dryer, make sure the dryer is in hot air, and run it there. And viruses, bacteria, they just don't like that. So you should have sanitized your clothing at that point. At that point, after you've taken your shower, after you've gotten the clothes that you were wearing in the washer going, hopefully you have some Lysol wipes or something similar. You pull those out and go to the doorknob, wipe off the doorknob, both sides. Wipe down the light switch in your bathroom. Wipe down anything you might have touched in the bathroom before you took your shower. You want your home to be a clean space. It's your safe place. And then in general, the basic rules of hygiene. Keep your kitchen clean, keep your bathroom clean. This is all vitally important. Rule 3, wash your hands with soap and water. Soap and water trump a hand sanitizer. So, and one of the things you can do there is if you find yourself in the grocery store and you've been touching a lot of things, put a firewall there. Go into the bathroom, wash your hands with soap and water. Okay, rule 4, social distancing. Now in the public media, they'll talk a lot about having a minimum of 6 feet. This is something that's somewhat unique to COVID-19, but apparently it can be in the air. So it's called aerosolized virus. And just speaking and breathing, you're pushing out the virus. Now, this is not the old movie Andromeda Strain where germs float for miles and miles. Science just doesn't work that way. What would be involved here is, as you talk, the aerolized virus would go 2, 3, 4 feet. So that's why you want to stay at least 6 feet away. So what I'm looking for when I'm in a grocery store, or listening for even more so, is if someone is coughing. If they're coughing, I'm gone. I'm heading away from them. I'll find a longer route to whatever product I'm looking for. But stay away at minimum 6 feet. And where you do encounter this is when you go to the cashier station. Now, little hint there. That cashier, whether they have no gloves on or not, or they have a pair of gloves, they're touching all this product. They're touching all this dirty money, which not a lot of the data out of China can you really believe. Certainly the metrics is. But one thing they did there, they burned a lot of their cash because they found it could, the virus could stay on the surface of the money. So you kind of want to avoid the cashier, like cashier station. I normally don't like these self-service things where you scan everything yourself, but I do now. So when I go to the grocery store every 2, 3 weeks, that's when I'm using the self-service scanner, because the only hands that's touching this product is my hands. So social distance is very important. Now, white paper studies where academics have studied this is when you cough, there's what's generated as water droplets, and virus can attach to that. And the studies showed in the vast majority of the cases, it would be totally dissipated in 10 to 12 feet. So my suggestion, if you think somebody around you is going to cough, try to stay 15 feet away. Now, I will mention that in one of the white papers that I read, it said like the world's record was 26 feet. But at that point, it would be greatly dissipated. So I try my best to stay 15 feet away from anybody in the store. Rule 5, don't touch your face in public. So, myself, I'm outside of the grocery store or the pharmacy, and I only do this every 2 or 3 weeks, and at some point that may come to an end. You're out there, and your eye's itching, your nose is itching, your mouth is itching. Good time to scratch it, because you haven't put your gloves on, you haven't committed to going in to the brick and mortar store, which has other people. So now, and this gets a little bit ahead of myself, but even without personal protective equipment, once you get out of your car and you go into a store, do not touch anything above your shoulders with your hands. Certainly don't touch your eyes, nose, or mouth, because that's how you could become affected. Now, you'll actually find this kind of difficult to do. When I was in nursing school, they would have us practice at home not touching our face for an hour, and it was challenging. Now, once you've started working at a hospital and you acquire, and this was pre-virus, pre-COVID-19, when you acquire pink eye or sinusitis, or in my case, both of them at the same time, it's lesson learned. I could go 12, 16, 18 hours without touching my face, and that's what you've got to do once you're in public. So once you get out of your car and you enter that brick and mortar store or pharmacy, you're not going to touch your face until you're home and you've washed your hands and you've taken your shower. Rule 6. When you touch something in public, a surface or an object, your hands may be contaminated. So, rule 1, don't touch your face. Just as I strongly impressed with the previous rule in 5. So, your hands are contaminated. Don't touch your face until you've washed your hands at home and taken the shower. Now, rule 7, use personal protective equipment. Now, what is this in the terms of nursing terms? Well, for the lay public, I would submit it's a pair of gloves. It's a mask. It's wraparound eye protection. And you can improvise all sorts of things. I'm actually primarily using wraparound glasses that my wife was a science teacher. And for some of their lab experience, they had these clear glasses that go all the way around. That's what I'm using. Now, if you don't have a surgical mask, the little surgical mask we see on so many doctor shows, medical shows, and you don't have an N95 that's being pretty widely publicized in the mainstream media, then improvise something. And people have gotten quite creative with that. But if nothing else, take a Boy Scout bandana and wrap it up, put it back of your head and tie it up. Now, I will say unequivocally, the N95 is far superior to a surgical mask. I will admit in the store I noticed a surprising number of them, and half of them are putting them on wrong. There's 2 straps, one go above your ear and one goes below it, and it will be quite tight on your mouth. It's not comfortable at all. And so for a non-nurse, get in that store and get out of there in 30 minutes. And you can actually start developing a little bit of hypoxia. You're low on oxygen, a little bit of a headache. My heart goes out for these nurses and the other hospital workers who are wearing these N95s for 8, 10, 12 plus hour shifts. But wear those personal protective equipment. They will make a difference. Now, a pandemic is a little bit like a nuclear World War III. We're all on the front lines. So if you have gloves, masks, wraparound eye protection, my suggestion is use them to go to the pharmacy or to the grocery store. Now, without a question, the mainstream of manufacturing of this type of equipment should be going to the hot spots, the hospitals, and to the healthcare workers working there. And my prediction is in several months, there will be an absolute flood of this equipment for healthcare workers. And a month or 2 after that, there'll be a flood for the general public. Get it if you can and use it. And you wear that equipment as long as you're in the store. Don't reach your hand up and touch your face. Don't touch the mask. No. Until you're clear of the store. When I go up to my car, I open the car, I reach in, I get some hand sanitizer because there's no, naturally in my car, it's not a camper. I don't have soap and water facilities, so I put the sanitizer on the gloves, and I wash my hands so the gloves are reasonably clean. And then there's a certain way where you take a dirty glove and you pinch the other dirty glove and you just roll it off. Now I have a clean hand in theory. You take a finger and you put it into the other glove and you just push that out. And there's a way that you then fold them into each other. And then properly, I put it into a shopping bag and push it deep down into the garbage. Please don't throw it out on the parking lot. That's just bad. So these are some of the ways that you can prevent becoming infected by COVID-19. Use them. Be prepared.